Here's something I bet you didn't know. In Taichung, which is Taiwan's third largest city, there's this twisted underground gambling scene. Doctors, nurses, and even the families of these poor cancer patients are placing bets on when the patients will kick the bucket. And we're not talking about a few isolated cases. This is a full-blown industry worth over $30 million. On one street alone, there are over 60 so-called senior clubs that are nothing but gambling dens in disguise. They're betting on which cancer patient is most likely to die within a month. And get this, the people who are supposed to care for these patients, like doctors and nurses, are in on it too. Even family members are getting a piece of the action. Imagine being a dying patient in a hospital, waking up to see not just your loved ones, but also a bunch of gamblers checking your vitals and asking about your prognosis. It's like a scene straight out of a horror movie. Here's how this gruesome game works. A dying cancer patient is put into play, and gamblers have to make a bet of at least $40. Some have even bet up to $350,000. If the patient dies within a month, the house takes it all. But if the patient survives past that, the payouts to the gamblers increase with each day and week the patient lives, up to 6 months. And the most appalling part? The bookies actually ask the patient's family for permission to put them in the game. They even promise the family 10% of the pot if the patient survives another month. In some cases, families are offered bonuses if they tell doctors to withhold life-prolonging treatments. It's a sick, twisted game that's hard to resist, especially for families who can't afford burial costs. Taiwanese police are investigating this macabre trend, but man, it really makes you think about the world we're living in.